So welcome everybody to our webinar, Introduction to the Evidence Pie. I'm delighted that we've got Zoe, Lancelott and Rhianydd Davies here from Rhondda Cynon Taf HDRC. In a moment I'll pass to them and they're going to take you through how they've adapted this model to help form the common language that their elected members and staff are using when it comes to talking about sources of information for research. So a couple of quick reminders before we get going formally. Please do keep your microphones off through the session, but if you want to switch cameras on or off, that's entirely up to you. We are recording, so it's up to you whether you want your face to be on that. Closed captions can be accessed by clicking more on the Teams toolbar and then language and speech, then CC live captions. I'll pop that into the chat as well. Our presentation's scheduled to run until 11 o'clock and we've got about 10-15 minutes dedicated to questions at the end of time. So please pop up your hand or pop a question in the chat and we'll help keep an eye on that throughout the course of the webinar and then at the end. Slides will be emailed out after the presentation along with the recording and an evaluation form, and that really helps us to collate feedback as we're developing the offer from the Specialist Centre. So without further ado, I'd like to welcome our guest speakers, let you know a little bit about their background. Zoe Lancelott leads the RCT HDRC team and has a wealth of experience in working with children, young people, families and the community in the public, private and voluntary sectors. Zoe has lived and worked in RCT for 30 years and has a proven track record of transforming public services to improve outcomes for those who face barriers in life. Rhianydd Davies is RCT HDRC's Organisational Development Lead, and she's been working in the Council and Human Resources for over 20 years. She previously managed the Training and Occupational Health teams and sat as a Senior Management Partner for HR within that team. She brings a huge amount of knowledge and experience of RCT Council and its organisational development. So along with the rest of the team at RCT HDRC, Zoe and Rhi's work's crucial in driving evidence-based decision-making at all levels within the council, aiming to break the cycle of poverty and improving the life chances of the most disadvantaged residents. So Zoe and Rhi, I'll now pass over to you.
Lovely. Thank you very much, Nicola. Borodar, good morning, everyone. It is an absolute pleasure to have been invited to deliver this webinar on our work on embedding evidence-informed decision-making into everyday practice in Rhondda Cynon Taf and by using the evidence pie. We are really proud of having produced the evidence pie and the progress that we've been able to make as a result of having a common language and a shared understanding of what the HDRC is aiming to achieve. But we're even more proud that we have been able to share this and that a number of other places in the UK are finding it equally helpful in their own discussions about what evidence looks like and how it's used in local authority settings. So I'm just going to take you through the agenda for the session. Laura can just knock the slide on for me. Brilliant. So we're going to give you a very, very brief, quick overview of Rhondda Cynon Taf and the area that we're in. We're going to introduce, obviously, the evidence pie, purpose, origins, principles and application. We've got some, it's only a small amount of impact, but we've got a little bit of early impact to share with you. And then also how we're currently sharing our learning so far. We have purposely left quite a bit of time at the end for any questions. So if you've got anything that you want to ask, either pop it in the chat or wait till that section and then you can pop your hands up and ask us those questions. What you'll also find is that me and Rhi are going to swap over some of the slides just to keep you on your toes and to give you a bit of a break from having just one voice for a period of time. Next slide, please. Okay, so let me start by telling you a little bit about Rhondda Cynon Taf, or RCT as we're known. We are, as you can see on that map there, we're approximately about 15 miles north of Cardiff in the South Wales Valleys. We've got almost 250,000 residents, making us the third largest local authority in Wales, after Cardiff and Swansea. We're fiercely proud of our industrial coal mining heritage, which both shapes the physical landscape of the area, as well as our cultural and social identity. We are the birthplace of both the Welsh National Anthem and also the infamous Sir Tom Jones. We're the largest single employer in the area, employing around about 10,500 staff, and 83% of them also live in RCT. So it gives the council a dual responsibility to this group both as an employer, but also provider of services. We're also challenged by a number of socioeconomic factors that have significant impact on the wider determinants of health and health inequalities, including some of the highest rates for alcohol-related hospital admissions, low birth weight babies, respiratory disease, poor quality housing, obesity, educational attainment, and child poverty in Wales. But most starkly, we can expect to live almost 10 years less than some other parts of the UK. And this is why being awarded HDRC investment by the NIHR has been a real game changer for us. And across the collaboration, there's a real energy and a commitment to use what we see as a once in a generation opportunity to make a real change for the people of RCT. And the evidence pie is one of our vehicles for being able to do this. Next slide.
Thanks, Zoe. So let me introduce you to the pie, the star of the webinar, I suppose. So the evidence pie draws on the work by an organisation called Foundations, previously Early Years Foundation, that looked at a type of evidence needed to inform decision making. So at a glance, we can see that there are 6 defined types of evidence, all equally relevant. There's no hierarchy in terms of what's more important than the other, but a good way to talk about evidence. So it's a good tool in terms of being able to discuss all the different types of evidence. And it's more likely that everyone can contribute to at least one or more of those segments or types of evidence. So it's a tool that everybody can use. So we've used the pie for a number of different audiences. So for our discussions with residents, council staff, managers, partner organisations, and our organisations in the community and elected members. So it's really about us being able to use that tool and that common language. It's likely to have evidence-informed decision making. Not one of those evidence types is enough on its own. So they need to be brought together, analysed and integrated as a whole. So if we take a look at each of the segments or types of evidence, so the professional knowledge is really refers to the practitioners who've been doing the job, know what the problems are, what's already been tried, what's worked and what hasn't. So it's bringing in that experience. Lived experience is the experience of anyone really that's had that experience, but in an example of that is the experience of residents using any support services that we've been having, they've been accessing, and what problems they're experiencing, how it helped, that kind of thing. The population and organisational data. So population data is looking at things like that census level data or data from ONS or other organisations that gives us a sense of what's happening in the RCT population and how that compares to other areas. The organisational data is all the stuff that we collect as an organisation, as a council, the different kind of systems that we use and the different kind of data and evidence that holds. But it's also about how much resource we have into putting into things, how many people have gone through a service, etc. But for us, it's also about how we share that information. So lots of services capture those that evidence, and we'd probably say that we were an organisation that was data rich, but actually we could probably do with sharing that information across different services or being able to use that in different areas. Impact measurement then is really about what, as it says on the tin, what the impact is. So what's happened to that person receiving that help and support? Has it made things better? How has it made things better? That kind of thing. And then the academic research is about what evidence is out there for particular initiatives, and any evidence saying that it's worked in different places, and has it worked before? Is there, how can we draw from that learning from the academic side of things and how we can make it relevant and bring that into the decision making in RCT? I think I've covered them all then. So in RCT, we've used it across everything we do within the HDRC. So it helps us engage with people in that evidence-informed conversation to be able to generate, access and interpret the types more easily across the council. We've been able to identify which types are our strengths and where we have gaps, then how we can look at finding further evidence or funding for those gaps and engaging with researchers and accessing that funding, and encouraging sharing of evidence across the council, services and wider partners. Next slide, please. So Zoe touched on it at the beginning, really. So it's really a common language that everyone can buy into. It enables us to start that conversation about evidence, research and understanding, and how to use a range of evidence in that decision making. It's been designed to be inclusive and accessible for all audiences, and that everybody can contribute to that. And we've got a couple of examples of how we've done that. I'll hand back to Zoe.
Thank you. Next slide, please. Right, so to give you a bit of an idea really about the origins and where it's come from, we very quickly found out when setting up the HDRC that the term research in itself was something that seemed to be too far removed really for the council and its partners to be able to really buy into. What we did find was that the term evidence was probably nearer to what local government lexicon in terms of the type of way in which they talked about data and information that was available upon which to make decisions. So having identified that evidence was probably more of a palatable term than maybe research, because research always had the connotation that that was done separately by clever people over in a closed room somewhere else. Evidence was something that was far more accessible for staff and also for the organisation as a whole. What we did find, though, that there was a lot of varied and creative interpretations as what evidence was. So we wanted really to try and bring them together in the one place where we could talk about a range of different types of evidence, all in that same conversation. We also needed to explain the work of the HDRC in a way that was tangible and relevant across stakeholders. So not just council staff as part of that, but also voluntary sector organisations, community organisations, and also members of the public. So we found that the evidence pie was one way of being able to talk about the practical work of the HDRC, rather than just look at maybe some of that wider ambitions that again seemed quite far away from people who we were trying to engage in all things HDRC. In terms of the way in which we've implemented HDRC, and we've established that in RCT, we've adopted very much a transformational change approach of how we've set up the HDRC, and looking at how we embed that work in the corporate centre of the council. So in some respects, our research and our project side of things have taken a little bit of a backseat while we've looked at how we can link and dock in the HDRC into the wider infrastructure within the council. And in order to do that, we needed some way of establishing a common purpose and to be able to answer that question of why the HDRC was aiming to make a difference and how it was going to do that in order to support that change. And then finally, we needed a non-threatening way of encouraging staff and partners to have some honest reflection and some honest conversation about both strengths and gaps in terms of evidence, and that's both the evidence base across the council upon which decisions are made, but also the skills base as well of staff in their ability to access, to gather and to use evidence as well. And we needed some way of being able to encourage them to self-evaluate a baseline position and to be able to do that confidently, having a tool to be able to use. Okay, next, please. Okay, so in terms of principles then, there are some key principles behind the evidence pie, and the first and foremost is that all types of evidence are equal. We were really, really keen to have something that showed that there wasn't a hierarchy in what we were trying to do. It wasn't that we collect evidence, but this one has more weight than the other. It was about ensuring that we have a good range of robust evidence that everybody feels that they're able to contribute to. Another of the principle was to make it as bold, visible and accessible as possible, to make it unavoidable. And that is something that we've used almost as a recognisable brand across the council. So in a lot of council documents, Now you will see the evidence pie there in the way in which we report findings and outcomes and outputs from the HDRC. Everything is linked back to the evidence pie. We wanted to make sure that it was completely unavoidable, and that if nothing else, if there is no other legacy that the HDRC is able to leave, it leaves the evidence pie in RCT as an ongoing conversation. So the fact that it is very bold and it's very in your face and you can't ignore it, it was very much done on purpose. We also wanted to ensure that that principle was there to, whilst we use the pie, the pie may look like all of those different types of evidence beautifully fit together. In reality, we know that's not the case. So what comes with the evidence pie is that explanation that it is absolutely okay for different types of evidence to say completely different things, that it isn't the responsibility of council staff or partners or anybody else involved in knowledge mobilisation to find one definitive truth. It's okay for it to be messy. It's okay for the process to be confusing. And it's okay for that to generate discussion between different types of stakeholders about how that evidence can then be synthesised, how it can be interpreted, and how it can then be used in decision making. So we didn't want people coming in and thinking, well, I've got to make the evidence pie work, I've got to make it fit together, I've got to find evidence that corroborates all the other different types. It was perfectly all right for that to be messy. Another principle was that every single stakeholder, so anybody at all who sits around the table to have any discussion about evidence, will be an expert in at least one of those areas of the evidence pie, whether it's your own lived experience, whether it's your professional career experience, whether it's some data that you hold, whether it's academic research papers that you've read. Every single person has something to bring to the table. And again, that reinforces that non-hierarchical approach to the use of evidence within the pie. Similarly, every single stakeholder sat around the table will also have one area that they would benefit from developing more understanding of, or more skills or more access to, in terms of the gathering and interpreting of that. So again, another really good equaliser in terms of keep reinforcing the need for things to be equal in terms of different types of evidence. And finally, the principle that effective knowledge mobilisation is absolutely a team sport. That's not something that just the HDRC team can do. It's something we've been very much encouraging our voluntary sector partners, our members of the public, anybody really involved in our wider collaboration, that knowledge mobilisation works best when we all do it together. It works best when we are able to share pieces of evidence across sectors, as well as across the council services, so that we're able to inform some really rich discussion and the decisions that come from that. Next slide, please.
Thanks, Sarah. So the evidence pie is central to the work of the HDRC in RCT, and has also been integrated into key areas of council business. So we'll take a look at those now. Next slide, please. So the council's performance, we've embedded the evidence pie into the council's performance management framework. The annual service self-evaluation that each service area has to do now utilises a range of evidence in reviewing performance and business and strategic planning decisions. The template has been amended to link directly to evidence pie, supported by a HDRC help sheet that provides direct links to sources of evidence. And that's where managers can actually use some of that data and that evidence to be able to pull into the use for their reflection of their services. It also helps from a HDRC perspective in terms of help identify gaps in evidence and skills. The next one is around scrutiny. Oh, sorry, Laura, we can go back. Sorry. There's around scrutiny and committee working group. So we're piloting a new terms of reference structure for scrutiny committee working groups, shaped by the evidence pie to ensure the work of elected members is evidence-led. So one of the examples of this is we've got a working group on scrutiny around child poverty, and we have lived experience advisors providing their insight in the working group as part of a member of that working group involved in the decision making. Thanks, Laura. Next slide. The next bit is around capacity building. So this is where the HDRC training offer for council staff and elected members has been developed to build skills and confidence to access, interpret and use these 6 types of evidence in the everyday work of the council. So it's not just about skills building. The feedback that we've received is about for the workforce and our partners and our residents about building that confidence in using evidence. And that's key for us in terms of how can they manage conflict, as Zoe mentioned in that evidence. All of the training is linked to the evidence pie. In terms of Cabinet and Scrutiny Committee reporting, we've got work underway at the moment to revise the formal reporting structure to clearly identify the evidence base underpinning the recommendation of officers and scrutiny committees and the decisions made by Cabinet. So again, we introduced a members reference group to gain insight from members to look at their development needs in terms of evidence, but also to champion the work of the HDRC, to name a few things. But one of the areas that came out of that was about identifying the reporting template, some revisions in those. Next slide, please. So as the HDRC, we used inquiry clinics used as a basis for understanding the research and evidence gaps for council services, requesting support from the HDRC. So we had an inquiries window and inferred that we opened up for. In our first window, we received 15 inquiries. Inquiry forms and clinic discussions are structured around the evidence pie to support council staff to identify existing evidence base. And this framework we use to manage these inquiries is based on the evidence pie, a structure that managers can use going forward, sustaining for the future. Sorry. The other thing then is around the foundation for building an evidence infrastructure to underpin that evidence-informed decision-making in the council. So work on creating a HDRC evidence and data repository that's built around the evidence pie, making it easier for council staff, partner organisations to find sources of evidence and data by evidence type. So I'll hand over to you.
Next slide, please. Okay, so we're using it as a means to monitor impact and to also track culture change. So we have collected some baseline information on access to and the use of different types of evidence across the council. And we'll be using that then to track and identify changes over time. What we have found in the evidence pie is that we're incredibly good with population data, with organisational data. What we found as a council is that we struggle in some areas with lived experience. We've either got some really good practice or some non-existent practice when it comes to lived experience. And I'm sure we're not on our own in terms of councils probably being more comfortable to do consultation work with members of the public than maybe doing more of that co-production and that embedding lived experience right into the heart of what we're doing. And as Rhys said, we have managed to do that with some of the scrutiny committee work that we've done, having placed members of the public with full voting rights into democratic processes of the council. Other areas that we do struggle with as well is obviously academic evidence and being able to access that as a council. And thirdly is impact data. And even though we have a lot of organisational data, what we've also found is that the skill base really to be able to interpret that and to look and answer that so what question probably needs some more work. So it's been really helpful for us to get a starting position as to where we are as a local authority, and it's helped to direct the work of the HDRC in terms of areas that we can help to build strength in as well. We've also used it as that foundation, as I said earlier, to the building a consistent and inclusive approach to knowledge mobilisation, and our work involving our formal collaborating partners, but also citizens, local community organisations, using the evidence pie to encourage that collective approach to evidence gathering, interpretation and reporting, and also building that confidence of non-academic stakeholders to engage in knowledge mobilisation activities. And some of the early findings that we've had there is that traditionally as a council, We know that our voluntary sector organisations and partners have a wealth of information, and we might collect it as part of commissioning arrangements and monitoring arrangements of any grant funding that we give to them. However, that doesn't always come into our decision making. So there's ways in which the HDRC can open up opportunities for us to be building consistent and more sustainable ways of sharing information across organisations for a common purpose. Next slide, please. Okay, so as I said, it's still early days for us. We're a wave 2 HDRC. So even though we're coming towards the end of our second year of funding, we're probably coming towards the first 12 months of us being fully operational. But this was a lovely quote I wanted to share with you from June this year, having gone to the senior leadership team to do the 6 monthly updates on where we are with the HDRC. And this was a fantastic quote that came from one of the members of the senior leadership team, who said, the HDRC is clearly having an impact already. I met with elected members last week to inform them of a change we needed to make and I had the evidence pie used against me. I was asked to identify the range of evidence upon which I'd use to make the decision. So whilst we'd never imagined that the evidence pie would be created to be weaponised, it's the fact that it has. And I think this is one of those areas really where the HDRC and that role of positive disruption is really, really important. I'm seeing all these icons coming up from the screen. That's lovely. Thank you all. But yeah, that was definitely, I think, the highlight of the year, which was absolutely, perfect in terms of what it was that we were trying to do. And the fact that we'd managed already to have elected members so engaged in the evidence pie, not only in how council officers use that to build their decisions, but also elected members and how they're using it too. So we're piloting a new terms of reference for scrutiny working groups around the evidence pie. And that again has given us lots of learning in terms of the way in which we present information as a council to elected members and the way in which elected members receive that information and want that presented as well. So lovely to see it in practice. Less comfortable, I think, for the senior leadership team, but really, really great to know that it is being used outside of our own discussions. Next slide, please. Okay, so just a very quick slide from us just to explain really about where we've been sharing this learning. And I said it is an absolute honour really for us to be able to share what we've done. And we're always very, very happy to talk to anybody who's got any suggestions or any thoughts, who wants to talk us through some of the practicalities behind where we've got to with the pie. Obviously, we use it everywhere now in the council. We've started to increase more how we're using that with our community partners as well, the conversations that we're having. The Welsh Local Government Association has also been very, very interested in the use of the evidence pie because of its accessibility around elected members, because of the popularity really with elected members who are able to identify different sources of evidence as well. So that's now been rolled out for elected members involved in scrutiny committee for training across Wales, which is great. Obviously, we've had great support from the NIHR Research Support Service in terms of sharing that not only with other HDRCs across the UK, but also with local authorities via the LARP programme as well. So we're always very, like I say, we're always very happy if anybody has anything that they want to discuss with us after the webinar. We'd be more than happy to share our learning. And then the last slide, I think, is just to give you some more information. We have both a website and an engagement platform in one called Make a Change RCT. That enables us to be able to not only talk about the work of the HDRC, but we've got a number of polls on there. We're able to disseminate information. We are able to share information on our collaborating partners. And we also manage public involvement in those programmes for people to get involved, to find out a bit more. Or there's also the email address if anybody has any questions after this. So, as I said, we purposely kept it nice and brief for you, just to see if anybody has any questions that they wanted to ask. Just going to check the chat at the same time.
Either put your hand up or drop a question in the chat.
Just having a look. This one there from Kirsty. Yes, there's a question there about using the approach, whether we're happy for people to use it. Absolutely happy for anybody to use it. We've been in touch with a number of local authorities who are using it for slightly different purposes, or have gone, you know, wholesale to use it. But yeah, more than happy with that.
I think
Thanks,
somebody's
Sarah.
using it as a jigsaw as well, though, aren't they?
Yes.
Oh yeah, that's a good idea, isn't it? Sorry, I should have come off camera and just asked that question. How are people, I guess, referencing you, or are you happy for them to make their own kind of version of it with different colour? Do you know what I mean? That kind of semantics of how it's used. Do you want to be?
Yeah, all we've asked for really is that, yeah, if we can just be referenced with obviously the foundation, the original, and just RCT HDRC, that would be great. But yeah, that's the
Thank you. It's brilliant. I love it, by the way.
Thanks, Kirsty.
Thank you.
So there's a quick question there around when you set up the inquiry clinics, what were the type of inquiries we got?
The inquiries, right. We did it really to put our sort of like dip our toe in the water to see where the appetite was across the council for the type of evidence gaps that they wanted to look at. We had a range from, I think we had a total of it's 13, I think. Sorry.
Yeah.
A total of 13 that came from, I think it was about 8 or 9 different departments. So we had from active travel to increasing foster carer uptake. We had, I'm trying to think, some help with getting the evidence base to do housing support strategies, youth service support strategies. There were some requests from partnership arrangements to look at how to measure the impact of a housing outreach service was one was integrated care services. What else did we have, Rhea? I'm just trying to think.
We had
there was
one from our residents in RCT that started out looking at digital access to services, but actually it's turned out to access to council services. So the fact that they have got the digital skill and have got a digital kit, but actually they want to talk to someone. So that's a project that's actively engaging in with some of the residents. And some evaluation stuff.
Yeah, and there was a couple there about evaluating the children's services, the new model of practice in children's services, and also a joint one that came in from cultural services and libraries and leisure, looking at how to engage non-users. So how do they find out what it is that their non-users were interested in? So we've had a really, really varied range. I think what we have probably learned from that is we were expecting very clear knowledge mobilisation inquiries coming through that were, could you give us this information and this evidence and then work with us to implement it? What we've actually found because of the evidence pie is that only 3 of those are straightforward, what we would see as knowledge mobilisation. The others have come through very much, and they've forced us to develop a hybrid approach as the HDRC team, because what staff have been able to come in with the evidence pie and say, we've got evidence in this area, this area, this area, this one we haven't. We want you to support us to develop our confidence to be able to go and get that type of evidence. So they've been really proactive. And again, that's been thanks to the pie. I think that people have really, really been able to grasp hold of it and think, I am the expert in this area. I do know this bit, but I need a little bit of help over there.
There's a question there about are there plans for our training to be delivered externally? Yeah, totally. We're aiming to have all our training available for all our partners, anyone who wants to attend it, really. So that'll be done through our main website. So can you say a bit more about work related to the foster care?
Yeah, the that inquiry has come in, and the area that they were particularly looking for was access to some academic evidence in terms of recruitment and retention. And as a local authority area, we've done a huge amount in terms of looking at the removing the profit out of the care sector as well, because legal requirements coming up, but also about how we encourage people to take on new foster carers. What I think we have found is a lot of foster carers in the area retiring out, that we've got an older generation of foster carers who are passing the gauntlet on. But again, changes post-COVID, changes to I suppose society as a whole, is trying to understand a little bit more about how those cultural differences now may impact on our ability to recruit and retain foster carers in the longer term. So it's still quite an early piece of work, but it's been really interesting to be able to gather different types of evidence to the type of evidence we ordinarily would do. And I think it was a really nice example of saying, as a local authority using its traditional methods of collecting evidence, we've come as far as we can come with this. We actually need something a little bit new and a little bit different.
Next question is about, have we come across any evidence sources in the process of application that wasn't covered by any of the slices? Don't think we have we?
No, not so far. I'm touching wood now, because I'm trying to wonder how we're going to bit in an extra bit of the pie. I do like things to be even, so yeah, how we literally shoehorn another bit. I think what we have found is that there's been a lot of crossover between the different segments, so that organisational data and the impact data, the whole of the academic evidence and the impact data. So there's a lot of messiness around the pie, but we do spend a lot of time with holding people's hands and making cups of tea and saying it's all right to sit in that messiness. It's all right to do that, because nobody has that single definitive truth. And the whole point of decision making is that it is a process. It's not a final, we've definitely arrived at this. There's always that bit of interpretation, but it's about sharing that experience of going through the messiness.
There's a question about, has there been any use in the context of individual skills needs assessment to investigate or consider variation in knowledge about different types and sources of evidence, and how it's currently being used by individuals rather than the whole department? We visited all our senior management teams, and we introduced a training needs analysis that was based on the evidence pie. And any of our baseline and management feedback we've done all around the evidence pie. So it enables us then to look at which areas to concentrate in which areas. The other thing that we did ask in terms of training needs analysis was around the level of qualifications that people had in terms of previous experience of using evidence, perhaps that research skill, perhaps they're in roles that isn't using that at the moment, so perhaps they need that refresher bit. So, or being able to identify people who could help in terms of some of that research work in different service areas. So it's been really good to be able to, and then that can come back to us along with information from the annual service evaluations. We can identify the skills needs in those, so based by individuals as well as whole departments.
Yeah, just to also add as well, very early days, so probably this time last year, we sat down with all of the chief officers in the council and cabinet members at the same time with the pie, and just asked them, what are we good at, what are we not good at? So we've had some really, and it was as simple as that. It didn't have to be anything more other than let's talk about what this means. And there was a lot of discussion around professional knowledge and the level of professional knowledge. There's a huge amount in any council. There's a huge amount of professional knowledge, but it's to what extent that professional knowledge is encouraged in terms of decision making. And quite often, traditionally, we're almost, I suppose, encouraged to have a level of detachment from that, where we're encouraged to say, my professional opinion is this, but I will keep that to one side. What the evidence pie has said is that actually, resource-wise, council staff are one of the richest resources in councils. What they know and what they're able to bring there needs to be up front and centre as part of those discussions about decision making. So yeah, it has really, I suppose, challenged people's assumptions around different types of evidence, where their value is, in removing that hierarchy, and also about how you can include that wider than just council staff as well.
What segment of the evidence pie do staff find the most challenging? Lived experience voices, academic research, impact measurement?
To be honest, I think it's impact measurement, because we have so much organisational data. We have so much professional knowledge about what needs to happen, what we can't always do. We're not trained particularly, and we don't have the time or opportunity to do that interpretation of it and to be able to sit down and actually look at that impact. I think the pace that local authorities work at, that's been definitely something that we've had a lot of internal team conversations because of our academics within the team, very much about that pitch and pace for different bits of information, how that's used. Quite often it's about trying to get to the end result, and any change has got to be a positive from a bad situation, which again, you know, is very practical, hands-on, but it doesn't allow for any time to stop and reflect. It doesn't allow for any sort of impact measurement in a research or academic capacity to happen either. So I think impact measurement is probably most difficult because of the nature of local authority. But yeah, I think, again, academic research has been quite just traditionally difficult to access. So I don't think people, as a council, we've ever really gone out and looked for that. We've always been a very open council about having academics come and work alongside us. So if you have any academic approaches, RCT has always been, you know, there was always, you know, lots of talk about if there's a pilot going, RCT would have it. So we've always been very forward thinking as a local authority to take whatever evidence or findings we can that might help. But I don't think we've ever really been in control of that in terms of being able to identify where academic evidence may help us. So
I think lived experience as well has been able for us to change that conversation around that. So I think as a council, we've got an obligation like to consult with residents and the communities. But actually, I think this helps us actually think about it differently. So it's about, we've got a place for consultation, but also about being able to bring the residents into some of that discussion around the decision making and getting that lived experience in. So it's been able to change the people's mindsets around that as well. Some service areas are great at doing it, but it's about just being able to show that everyone can get involved in that way as well. So do you have any experience integrating this with the local authority research governance, as they're unclear about how internal council-led research would fit in the pie? Would it fall in impact evaluation? You see, that one's there's several questions in one.
Yeah, I'm just trying to unpack it now. Internal research fit into the pie, fall under impact evaluation. Right, yeah. What we've been doing for now really has not been looking at research per se. So we've not looked at undertaking research, and as a HDRC, that won't be one of the main focuses for us about doing a research project. Ours is more about that knowledge mobilisation. So we're coming very much from the cultural shift about, for now, in this early stages of the HDRC, is about just increasing the confidence of staff to use evidence. So we've more or less come away from the thought about this being a research project and more about an evidence gathering approach, more about looking at what we've already got, being open about what we haven't got. And we've tried to do it as collaboratively as we possibly can. So for every inquiry that's come in from a area within the council, we have purposely gone out to find a collaborator from an academic background who might be interested in that piece of work. We've gone to find voluntary sector organisations, members of the public, and what we've done really is to look at a research, well, more like a project group that brings experts from each of those sections of the pie. And that's how we've looked at putting together those initial discussions. So even though we've got members of council staff who are saying, we need to know more about this, what we've tried to do is to open the door and say, well, these are the people that can also help you as well. So ours is very much from a practical stance at the minute, rather than actually that undertaking of research. What we have done for anything that is evaluative or specifically impact evaluation work, that's where we are looking to put joint funding bids in with academic partners to be able to draw down funding to do that. Obviously, the HDRC would support that, but that's not been fundamental to the work that we've been doing at the minute in the council. So it's more about how we match up council services with academic partners to do that funding side of things. So at the minute, it is very much about just getting people far more comfortable with evidence, with using it, with practically applying that on a day-to-day basis.
Martin's a professional researcher at council. Where do you put people like me and our work who do our research, but we're not, who do the research, but they're not academics?
Council. Okay, we as a council don't have any researchers, so the HDRC has been fantastic for us, really, about bringing I suppose research experience into the council. So what we've done as a HDRC is our central team is based within the council, so we have co-located 12 members of staff as part of that. We do have 3 academics from Cardiff University who are working almost as embedded, not so much doing research, but embedded researchers in terms of bringing those skills and tools and advice and guidance into the council. So at times it's been quite frustrating, I think, for them in terms of where do they fit, and this isn't traditionally how they would have worked. But what we have found is it's absolutely broken down those barriers between local authority staff feeling that academic research is too far away, about being able to, I suppose, respond to the needs of service areas with the most helpful tool at the time. So it's been less about the theory, it's been less about the, I suppose, the usual practices, and more about how we can adapt that expertise as of professional researchers into the work of the council.
Just 2 more, though. So is there a challenge opportunity in the council you haven't been able to take on yet?
Challenge opportunity haven't been able to take on yet. I don't think so. I think we have, I said early on that we have absolutely got so much commitment, I think, and energy going into the HDRC at the moment. It is a little bit overwhelming, I'll be honest. We honestly imagined that we would be at least, year 3 or 4 before we were able to tackle elected members, and that we might need to find a way to have a hook to get in. They were the first to knock down the door. They were the first to come with a child poverty project that elected members said this is most important to us. But similarly, the senior leadership team as well have done exactly the same. So we've got a preventative spend project that's ongoing, which is helping the council to code budget against prevention activity, to be able in the longer term to measure that in terms of looking at return on investment of prevention work and early intervention approaches. So that's a really big piece of work that's likely to be multiple phases over the course of the whole of the HDRC. But what we've also got as well, a more recent one, has been to look at community resilience, and a lot of our corporate plan talks about building community resilience to be able to support a better relationship between the council and its residents. And that again is an absolutely huge project, and that was one area that I think as council officers we knew we needed to do, but I think the way in which the senior leadership team has definitely come and said we need to crack this nut and we need to do it now. We need to understand what's behind our relationship with residents. We need to look at how we improve it. how we strip back some of the ways that we communicate, the ways that we change terminology. So we've got a lot, I think, of backing for the big things. So I think that's probably going to be dictating the work that we're doing over the course of the HDRC. But so far, there's been nothing that's been on the table, that's been off the table, other than as managing capacity. But I think the way in which we have tried to change and make more accessible our offer as a HDRC team, the more we've been able to link projects together to be able to give us the capacity to work on. So I'm sure there will be things, Nick, that appear, but for now, yeah, the council is well behind the big stuff at the minute.
And the last question from Fiona is about, has quality of different types of evidence been a focus in conversations about the PI?
Yes, it started to. Yeah, we've started to. I think we've spent this last year just getting it out there and getting people to be able to use it, to be able to talk about it, to feel a little more comfortable. What we are starting to do under the project work now is to say, great, you've got lots and lots of evidence, but let's have a look at the quality of it. Let's look, did it tell you what you needed? Really good example is organisational data. We could drown in the amount of organisational data that we've got, but we're never always quite sure exactly why we're collecting it. So we've started to do that challenge now about why do you need it? And I think that's the bit really about having that professional research expertise come into the council has been and it sounds really simple, but it's been a bit of a game changer, which has just been about defining that research question. So defining the question, what is it that you want to answer? And then looking at the evidence that would then give you that answer, rather than I'm going to collect everything because at some point in the future I'm likely to need it, even though I don't know what I would need it for. So we're starting to challenge a little bit of that culture as well, about that almost panic collecting of irrelevant bits of evidence, and focusing more on what is it that we want to know and what type of evidence is most likely to answer that for us.
Yeah, I think a lot of teams in the inquiries are actually reviewing themselves as well, what that data is given as part of the inquiries, actually taking that time to reflect on that and take a stance to say, well, are we asking that right thing, as Zoe said? So, and capturing that, and we've embedded it in our training as a natural thing to do, I suppose. But yeah, I think that's it. Thank you, Zoe.
No problem.
I'll hand back to Nicola, I think.
Yeah, just to say a massive thank you to everybody. But
yes, thank you.
If there are any questions, or you want to get in touch, or you want to talk through any ideas that you've got about adapting the PI or just using the PI as it is, please feel free to get in touch. Thanks.
So huge thank you to Zoe and Rhianydd for the webinar and for sharing everything so openly today, and those honest reflections on how it's working and the things that are going brilliantly and the things that are still challenges, because I'm sure that's resonating with a lot of people. And absolutely brilliant that you're so willing to share and talk to others about this as well, because we are in a huge collective. We're all trying to get to the same end point. And the more that we can share and talk and learn from each other, the better. So huge thank you to you both and the rest of the team at RCT as well. So a couple of things just to point out as we close up. I've popped a couple of 1-2 page easy reads in the chat, and they are actually learning stories that have come from RCT, one about the evidence PI specifically, but one links that into their use of the evidence PI with the work with elected members. Because that is such a sort of a theme that keeps coming up, and making progress with that group, and the conversations that have to be maybe a little bit different, acknowledging the roles that they play and how RCT have had successes with that. So please give those a read. And that's one of a series of case studies we've got on there, and we've got another webinar coming up from Gateshead HDRC. That's Michael Johansson on the 6th of November. and that is making research engaging. So that's some guidance and examples of how to make the research process interesting so that it encourages participation and demonstrates the benefits of being involved in research and the learning that comes from that. So huge thank you again to Rhi and Zoe, and I really do encourage anybody who's interested to get in touch with them, share the slides and the recording, share those case studies, and please name check RCT as well. It's great that they've done this work and they you know, can look back and see how that's been used and applied elsewhere. But certainly my experience is they're really willing to talk about all of their learning, all of the different things they're doing. So please do reach out. So thanks very much, everybody, for today.